Good morning. I'm Dr. Michelle Taylor, Shelby County Health Department Director and Health Officer. As a pediatrician, public health professional, Memphis Child Advocacy Center board member, and a mother of 2 children, it's clear that children are very precious to me. In my former role at the Shelby County Health Department, I worked in maternal and child health. In that role, I learned much about the living conditions and adverse childhood experiences that impact the health and well-being of our children. Many children in our community are growing up in homes and neighborhoods where violence is a daily fact of life. There are parents in our community who love their children tremendously, but struggle to give them what they need. There are parents in our community who can't find affordable, high-quality daycare, but must work outside the home to make a living. Too many parents struggle with substance abuse, creating a chaotic and insecure home life for their children. As a Memphis Child Advocacy Center board member, I'm acutely aware that children suffer abuse and neglect in our community every day. The multi-agency team headquartered at the Memphis Child Advocacy Center handles thousands of child abuse reports every year. Children come to Memphis Child Advocacy Center after abuse has been reported. While cases are under investigation, the Child Advocacy Center staff help parents, caregivers, and children find healing, safety, and justice. Unfortunately, too many children never make it to Memphis Child Advocacy Center. Their abuse and neglect go unreported, and some of these children will die as a result. As a parent, the death of these 3 children affects me deeply. The future was stolen from them, and their potential contributions to our community were stolen from all of us. As a physician and public health professional, I am struck by the fact that every one of these tragic deaths could have been prevented. The conditions that lead to abuse and neglect of children can be addressed by public policy actions, and not acting to make the necessary changes is also a policy decision. It will take bold and courageous action by our policymakers to help not only the abused and neglected children, but also their parents, their families, and their communities. Because poverty, violence, and adverse childhood experiences impact not only the child victims, but the entire community. And as such today, I choose to imagine and remember all 3 of these children, how they must have been at their happiest. All 17-month-old children in Shelby County, like Carson, deserve to toddle around, playing with a toy airplane while pointing at a plane in the sky. All 7-year-old children in Shelby County, like Jarvarius, deserve to ask why the sky is blue, or why the grass is green, or any number of questions all 7-year-olds ponder. All 2-year-old children in Shelby County, like Mario, deserve to smile vividly while listening to the adventures of Gerald and Piggy in a Mo Willems book. Don't let the deaths of these children be in vain. Let's commit to making the kind of bold societal changes that are needed to protect all children from poverty, neglect, and violence.